Did you know that where you live can predict how long you'll live? It's a shocking truth. Your zip code can be more powerful than your genetic code. Millions face preventable illnesses and premature deaths simply because of where they were born, live, work, and age. The stark reality is that health inequalities are not inevitable. They are man-made and as such can be changed. We have the knowledge, the tools, and the resources to close the health gap and create a world where everyone, regardless of their background, has the opportunity to live a long and healthy life. This video is about igniting a movement, a global conversation about a vision for population health. Section 2. A world of disparity. The statistics are staggering. A child born in a high-income country can expect to live 30 years longer than a child born in a low-income country. Within countries, the disparities are just as stark. In the wealthiest neighborhoods of some cities, life expectancy soars, while in the poorest, it plummets. From chronic diseases like heart disease and diabetes, which disproportionately impact disadvantaged communities, to mental health issues, the evidence is clear. Your postcode shouldn't be a predictor of your health. It's time to challenge the status quo, to dismantle the systems that perpetuate these inequalities. Section 3. A vision for change. A healthier world is possible, but it requires a fundamental shift in how we approach health. We need to move beyond a focus on treating illness to one that prioritizes prevention, well-being, and addressing the social determinants of health. This video will delve into the groundbreaking report, A Vision for Population Health, which lays out a roadmap for achieving health equity. Section 1. A stark reality, the health gap. The Vision for Population Health report paints a sobering picture of global health. It reveals a world fractured by a persistent and growing health gap. This gap, evident both between and within nations, demonstrates a harsh reality. Your life expectancy and overall health are significantly influenced by where you live and your socioeconomic status. The numbers are stark. In Sierra Leone, the average life expectancy hovers around 54 years. In Japan, it soars past 84. This stark difference of 30 years highlights a fundamental injustice. Millions are denied the opportunity to live long, healthy lives due to factors largely outside their control. The report serves as a wake-up call. It shatters the illusion that healthcare alone can bridge the health gap. Section 2. Beyond healthcare, the social determinants. The report makes a compelling case for the social determinants of health, the conditions in which people are born, grow, live, work, and age. Imagine two children born in the same city. One grows up in an affluent neighborhood with access to quality education, healthy food options, and safe green spaces. The other child, born just a few miles away, faces a starkly different reality: poverty, underfunded schools, limited access to fresh produce, and a constant exposure to environmental hazards. The report emphasizes that factors like education, income, housing, employment, and social support networks have a profound impact on an individual's risk for chronic diseases, mental health issues, and overall well-being. By acknowledging the powerful influence of these social determinants, the report challenges us to broaden our understanding of health. Section 3. Prevention is key. Investing in health. The Vision for Population Health report makes a powerful argument for shifting our focus from treatment to prevention. It advocates for a proactive approach to health, one that prioritizes early intervention and addresses health risks before they escalate into costly and debilitating diseases. This involves investing in early childhood development programs, ensuring access to affordable housing, creating safe and walkable neighborhoods, and promoting mental health awareness. The report highlights the economic benefits of prevention. Every dollar invested in early childhood development, for example, yields a significant return on investment through increased productivity, reduced healthcare costs, and lower crime rates. By shifting our mindset and our resources towards prevention, we can create a healthier and more equitable future. Section 4. A call to action. A blueprint for change. The Vision for Population Health report is more than just a diagnosis of a critical global issue. It's a call to action, a blueprint for change. It outlines concrete steps that governments, communities, healthcare providers, and individuals can take to close the health gap and create a healthier world for all. The report stresses the need for policies that promote health equity, such as increasing access to affordable housing, expanding early childhood education programs, and ensuring a living wage. This is a call for collaboration, for governments to work alongside communities, for healthcare providers to partner with social service organizations, and for individuals to advocate for change. The Vision for Population Health report is a roadmap to a future where everyone, regardless of their background or circumstances, has the opportunity to achieve their full health potential. The Vision for Population Health report doesn't shy away from showcasing the stark realities of global health disparities. It boldly unveils a world divided, where life expectancy is often determined by the accident of birthplace. This geographical lottery of health outcomes is a glaring indictment of global inequality. Imagine a world where crossing a border could add or subtract decades from your life. Sadly, this is the reality for millions. A child born in a high-income country like Japan can anticipate a life exceeding 80 years, while a child born in a low-income nation like Chad may only reach their 50s. The report forces us to confront this uncomfortable truth. Where you live should not determine how long you live. While the report highlights the stark health disparities between nations, it also delves into the inequalities that exist within countries. It reveals that the postcode where a child is raised can be a more powerful predictor of their health outcomes than their genetic code. Wealthy neighborhoods often boast higher life expectancies, lower rates of chronic diseases, and better access to healthcare. In contrast, disadvantaged communities struggle with higher rates of preventable illnesses, limited access to quality healthcare, and often, a sense of hopelessness. The report compels us to look beyond national averages and confront the uncomfortable reality that inequality knows no borders. The Vision for Population Health report goes beyond simply presenting data. It delves into the complex interplay between poverty, inequality, and ill health. It exposes a vicious cycle where poverty breeds ill health, and ill health, in turn, perpetuates poverty. Imagine a child born into poverty. They may face malnutrition, limited access to healthcare, and exposure to environmental hazards, all of which can impair their physical and cognitive development. This cycle is not inevitable, it is a result of societal choices. Section 4. A child's zip code should not predict their future. The Vision for Population Health report delivers a powerful message. A child's life chances should not be determined by the zip code they are born into. A child born into a neighborhood with high rates of poverty and unemployment is more likely to experience toxic stress, have limited access to healthy food options, and attend underfunded schools. These factors can have a lasting impact on their physical and mental health, educational attainment, and future opportunities. The report underscores the need for a paradigm shift. It's about creating communities where everyone has the opportunity to thrive, regardless of their zip code. Section 5. The urgency to act, a moral and economic imperative. The Vision for Population Health report leaves us with a stark choice. Continue down a path of widening health inequalities, or take decisive action to create a more just and equitable world. The report argues that addressing health disparities is not just a moral imperative, it is an economic necessity. The cost of inaction is staggering. Health inequalities lead to lost productivity, increased healthcare costs, and slower economic growth. Investing in the health of all citizens, especially the most vulnerable, is not a cost but an investment in a healthier, more prosperous future. It is time to recognize that health is a fundamental human right, not a privilege. Section 1. Shifting the paradigm from treatment to prevention. The Vision for Population Health report advocates for a fundamental shift in how we approach health, moving away from a reactive, disease-centric model to a proactive, prevention-oriented approach. This paradigm shift recognizes that true health equity is not just about treating illnesses, but about preventing them from occurring in the first place. Imagine a healthcare system that prioritizes early detection and intervention, where regular checkups focus on identifying risk factors and empowering individuals to make healthy choices. By investing in prevention, we can reduce the burden of chronic diseases, lower healthcare costs, and create a healthier, more productive society. Section 2. Investing early, the power of early childhood development. The report emphasizes that the foundation for a healthy life is laid in the earliest years. Investing in early childhood development is not just about providing childcare. It's about nurturing the physical, cognitive, social, and emotional development of children, setting them on a trajectory for lifelong health and well-being. Imagine a world where every child has access to high-quality early childhood education programs that stimulate their minds, nurture their creativity, and foster their social skills. The report highlights the profound impact of early childhood interventions. Investing in early childhood development is not an expense, it's a down payment on a healthier, more equitable future. Section 3. Building healthy communities, environments that nurture well-being. The Vision for Population Health report stresses that health is not just an individual responsibility, it's also a product of the environments in which we live, work, and play. Creating healthy communities is about designing spaces that make healthy choices the easy choices. Imagine neighborhoods where sidewalks are safe and inviting, encouraging physical activity. Imagine communities with access to affordable, nutritious food options, where fresh produce is readily available, and fast food chains are not the only option. The report emphasizes that creating healthy communities requires a multi-sectoral approach. Section 4. Empowering individuals' knowledge, skills, and support systems. While creating health-promoting environments is crucial, the Vision for Population Health report also stresses the importance of empowering individuals to make healthy choices. This means equipping people with the knowledge, skills, and support systems they need to take charge of their own health. Imagine a world where health literacy is high, where people understand the social determinants of health and have the skills to navigate the healthcare system. The report advocates for comprehensive health education programs that start in early childhood and continue throughout life. Empowering individuals is not just about providing information, it's about fostering self-efficacy, building confidence, and creating a sense of agency over one's health. Section 5. A shared responsibility, collaboration for a healthier future. Achieving health equity requires a collective effort from governments, communities, healthcare providers, businesses, and individuals. Governments must promote health equity through policies and investments. Healthcare providers should address social determinants of health. Communities need to foster social cohesion and support networks. Businesses can create healthy workplaces and promote work-life balance. Individuals must make healthy choices and advocate for better policies. Together we can ensure everyone has the opportunity to live a long, healthy life. Section 1. The Foundation of Fairness Policies for Health Equity. The Vision for Population Health report asserts that achieving health equity requires a shift in policy priorities. It calls for policies that prioritize the health and well-being of all citizens, particularly the most vulnerable. Imagine tax policies designed to reduce income inequality and provide a safety net. Social welfare programs as investments in human potential, supporting families in need. The report challenges policymakers to view every decision through a health equity lens. How will this policy impact the health of the poorest and most marginalized? Will it exacerbate inequalities or level the playing field? Prioritizing fairness and social justice creates conditions for all to thrive. Section 2. Early intervention, lasting impact, prioritizing early childhood development. The report makes a compelling case for prioritizing investments in early childhood development programs. It argues that these programs are not simply about providing childcare, but about laying the foundation for a lifetime of health, well-being, and opportunity. Imagine a world where every child, regardless of their family's income, has access to high-quality early childhood education programs that nurture their cognitive, social, and emotional development. Imagine programs that provide nutritional support, early literacy interventions, and opportunities for creative expression. The report highlights the numerous benefits of investing early. Studies have shown that high-quality early childhood programs can lead to improved educational outcomes, increased earning potential, reduced crime rates, and better health throughout life. By investing in early childhood development, we invest in a healthier, more equitable, and more prosperous future for all. Section 3. Building blocks of well-being, securing affordable housing and nutritious food. Access to affordable housing and nutritious food are fundamental determinants of health. Policies must ensure these needs are met for all citizens. Imagine a world where safe, stable, and affordable housing is a right. Families shouldn't choose between rent and food. Access to fresh, nutritious food should be abundant and affordable. Grocery stores and farmers markets should thrive. Fast food shouldn't be the only option. Prioritize policies that increase affordable housing, implement rent control, subsidies, and social housing, promote food security through SNAP benefits and community gardens, encourage grocery stores in underserved areas, ensure access to these building blocks of well-being, create a foundation for health and opportunity for all. Section 4. Leveling the playing field, education, employment, and social mobility. The report underscores the impact of social and economic factors on health outcomes. Policies improving education, employment, and social mobility are essential for closing the health gap. Imagine a world where every child has access to high-quality education. Imagine a world with abundant, meaningful employment opportunities. Imagine a world where social mobility is within reach for all. The report calls for policies that expand access to early childhood education, improve K-12 schools in disadvantaged communities, and make college more affordable. It advocates for policies that promote job creation, raise the minimum wage, and provide job training programs. By leveling the playing field, we can create a healthier, more just society. Section 5. A Health in All Policies Approach, Collaboration Beyond Healthcare. The Vision for Population Health report emphasizes that achieving health equity is not solely the responsibility of the healthcare sector. It calls for a health in all policies approach, recognizing that health is influenced by a wide range of factors, from transportation to housing to education. Imagine a world where policymakers in every sector consider the health implications of their decisions. Imagine transportation planners designing walkable cities that promote physical activity. Imagine urban planners incorporating green spaces into urban environments to reduce stress and improve mental well-being. Imagine educators prioritizing health education and providing students with the knowledge and skills to make healthy choices. The report urges governments to adopt a health in all policies approach, establishing mechanisms for cross-sector collaboration and ensuring that health equity is a central consideration in all policy decisions. By breaking down silos and working together across sectors, we can create a society that is truly designed to promote health and well-being for all. The North Karelia Project, a triumph of community-based prevention. Imagine a region grappling with one of the highest rates of heart disease in the world. That was North Karelia, a region in Finland back in the 1970s. The community embarked on a remarkable journey of transformation, demonstrating the power of community-based prevention. The North Karelia Project took a comprehensive approach to tackling heart disease. Instead of focusing solely on individual behavior change, the project recognized the influence of social and environmental factors. They engaged the entire community in a shared mission to improve health. The results were striking. North Karelia witnessed a dramatic decline in heart disease rates, a testament to the power of collective action. The project became a global model, demonstrating that by creating supportive environments and empowering communities, we can achieve significant improvements in population health. The key takeaway from North Karelia: health is not just about individual choices, it's about creating a culture of health, supported by the community at every level. Cuba's healthcare revolution, equity, and access for all. Cuba's healthcare system is admired for its universal coverage and focus on prevention. Following the revolution, Cuba prioritized healthcare as a human right. They invested in training, building clinics, and ensuring access for all. Cuba's emphasis on preventative care includes regular home visits. This proactive approach has led to impressive health outcomes. Cuba's commitment to equity and prevention yields remarkable results. The Kerala model, investing in human development for health and prosperity. In Kerala, human development is a priority. Despite low income, Kerala achieves health outcomes like developed nations. Investments in education, healthcare, and social welfare are key. High literacy, robust healthcare, and social safety nets ensure essential services. Kerala's focus on human development leads to better health outcomes. High life expectancy and low infant mortality rates are notable. Kerala shows that investing in people is essential for health and prosperity. A call to action: be the change. We've explored the stark realities of global health inequalities, but more importantly, we've unveiled a powerful message of hope. The Vision for Population Health report is not just a document, it's a call to action. a roadmap to a future where health is a right, not a privilege, enjoyed by all. But change doesn't happen by simply reading a report or watching a video. It requires action, and that's where you come in. Each one of us has the power to make a difference, to be part of the solution. Start by examining your own sphere of influence. Are you a parent advocating for quality early childhood education in your community? Are you a healthcare professional pushing for policies that address social determinants of health? Are you a student passionate about health equity, ready to volunteer your time and talents? Amplify the message, share the vision. The first step is awareness. The Vision for Population Health Report is a powerful tool for change, but it can only have an impact if people know about it. That's where you come in. Share this video with your friends, family, colleagues, everyone you know. Use the power of social media to spread the message far and wide. Start conversations about health equity in your community, your workplace, your school. Knowledge is power, and the more people who are aware of the challenges and the solutions outlined in the report, the more momentum we build for change. Download the report, read it, discuss it with others, organize a community meeting or a book club to delve deeper into the recommendations. The more we talk about health equity, the more it becomes a priority in our communities and in the halls of power. Our collective responsibility. Health for all is possible. Remember, achieving health equity is not a task for any one entity alone. It requires a collective effort, a shared responsibility among governments, communities, healthcare providers, businesses, and individuals. Contact your elected officials. Let them know that health equity is important to you, that you support policies that promote health for all. Advocate for increased funding for early childhood education, affordable housing, and public health programs. Support organizations working on the ground to address health disparities. Volunteer your time, donate to their cause, or simply spread the word about their work. Every action, no matter how small, contributes to the larger movement for change. We are at a pivotal moment. The choices we make today will determine the health of our communities and our world for generations to come. Let's choose to build a future where health is a right, not a privilege, enjoyed by all. As we conclude our exploration, let's reflect on our shared journey. We've confronted global health disparities and seen how a child's zip code can predict their health. Amidst challenges, we've uncovered hope through innovative solutions and community-driven initiatives. The future we envision is a tangible possibility, not a utopian dream. The Vision for Population Health Report provides a roadmap, but it's up to us to start building. Throughout history, progress on social justice issues has rarely been achieved through individual efforts alone. It has taken movements, collective action, and a shared belief that a better world is possible to drive meaningful change. The fight for health equity is no different. Imagine the power of millions of voices uniting to demand better health outcomes for all. Imagine the impact of communities mobilizing to create healthier environments, advocate for equitable policies, and support those most in need. Imagine the force of a global movement demanding that every child, regardless of where they are born, has an equal opportunity to thrive. The Vision for Population Health Report is not just a document, it's a spark, an invitation to join a global movement for change. It's a reminder that we are not alone in this fight, that together we have the power to create a healthier, more just world. As we conclude our journey, let's be honest with ourselves. We can no longer turn a blind eye to the injustices of health disparities. The data is clear, the evidence is overwhelming, and the moral imperative is undeniable. We must act, and we must act now. This is not just a call to policymakers, healthcare providers, or community leaders. It's a call to each and every one of us. We all have a role to play, whether it's educating ourselves about the social determinants of health, advocating for change in our communities, or simply making healthier choices in our own lives. Start small, start where you are, but start somewhere. Talk to your friends and family about health equity. Hit subscribe and hit the like button. Volunteer your time to organizations working to address health disparities. Support businesses that prioritize the well-being of their employees and communities. Every action, no matter how seemingly insignificant, contributes to the larger movement for change. The Vision for Population Health Report is more than just a set of recommendations. It's a testament to the power of human ingenuity, compassion, and our collective capacity for change. It's a reminder that a healthier, more equitable world is within reach, but it will take all of us, working together, to make it a reality. Let us leave here today, not with a sense of overwhelm or despair, but with a renewed sense of purpose, a shared commitment to action, and an unwavering belief in our collective power to create a world where health is a right, not a privilege enjoyed by all. The time for action is now. Let's build a healthier, more equitable future together. Leave a comment, and hit subscribe and hit the like button.